So with lymphatics, you need to start at the neck to open up the pathway up to the face. So you're going to start at your collarbone, but just off to your left side. It looks opposite on here because I'm doing the mirror image on the phone. So you're just dragging the skin because most of your lymph system is in the skin. And you're dragging and pushing the fluid where you want it to go. So there's this little shepherd's hook right under your collarbone where all of that stuff drains. You're going to start with like 20 strokes. Then you've got this little pocket here. You're going to pull that down the clavicle. Then you've got spaces up the front. And depending on how big your hands are or how big your neck is, determines how many spots you do. So I'm going to do 2. So I'm going to go lower and I'm pushing it down to that shepherd's hook. So it's just a little bit off to the left. And then you can see this big muscle that sticks out here. There's a chain of lymph nodes back there. So you need to grab the back of your neck and pull forward to try to activate those pathways. And then right here where the ramus of your jaw is, there's a big giant lymph node there called the water wheel, and you've got to activate that to start the face. And you're really just pulling down, trying to go behind this ramus of your jaw. Then you're going to do the horseshoe underneath your jaw, starting back. You can try using your thumbs. And you work your way all the way to the tip of your jaw, pulling it back down this way. You have like a cone-shaped watershed in your face, meaning that anything inside the cone is going to drain the front, and then anything outside this cone is going to drain to that water wheel. So we're going to do the cone first. You're going to pull down here. And if you find that you're a little bit more numb or you have lost some of that muscular control on that one side, do extra strokes on that side. So I don't do 15 to 20 at each of these locations. You're going to act like you have a mustache. So you're going to pull it down around your lips. Even get inside your nose. And then inside the cone actually includes part of this inner eye. So actually taking your pinky finger, your index finger, and rolling in and pulling down. And you're doing that on both sides. So that's the cone. So with lymphatics, you do a wash and a rinse. So that on the way up was the wash, and now you do a rinse, which is reverse order. So you're pulling back down again. You don't have to do as many strokes on the rinse, but the side that you've got the paralysis on, I would do more. Go ahead and do the 20 strokes on that side. Okay, so that's the cone, and now you're going to do outside the cone. So if this is kind of the watershed, anything outside that triangle is going to this ramus of the jaw. And it looks like I'm going pretty hard. I'm heavy-handed, but really you just need to move the skin. Okay, when you get to the eye, because you're probably having some eye drooping, think of your eye as like rays of a sun, and you're gonna do each individual little area around your eye to really start to get that to open up and clear that nerve that's inflamed. And again, you're doing a lot more strokes than what I'm showing you. You can actually do your eyelid. If you actually have to hold it, that's okay. But you're pulling that skin on your eyelid. Then it drains underneath your eyebrow, so you would pull down. So that would be done on both sides. And then you're going to do your forehead drains down to this ramus. So as much surface area as you can get. Behind the ear drains down this chain here, so you can even pull your scalp. So that's the wash, and now you got to do reverse order again. So you go forehead, you do each little spot around the eye, especially that paralysis side, and then pulling down here, and then you'll finish with the next sequence. So the back, pulling to the front, these little spaces here, this little hollow spot, and then you finish with lots of strokes right there at that shepherd's hook. I hope that helps you. I'm going to look up a cranial therapist for you also and see if I can refer you to somebody.